Hello to all our support fibro friends. Welcome to this very special interview. I am thrilled to welcome Carrie from My Several Worlds. She's joining us from Taiwan, so that's why we have a special broadcast tonight. And I've been following her blog post for a while. I love the content. She was a WEGO Health Awards finalist this year and just doing tremendous advocacy work. Welcome, Carrie, to the broadcast.
Hi, Mel. Thank you so much for having me tonight. I really appreciate it. I'm so excited to talk to you today.
Well, we really appreciate having you here and taking the time to do this. And it was so difficult going through all your life experiences on the questions of like where to begin. And I think we need to do part 2 and part 3 series for this because you've had tremendous amount of life experiences and also living with a chronic illness. But to get us started, maybe we can start from the beginning. Could you share a little bit about your health journey with our support fibro friends?
Okay, sure. I'm not going to take you back 17 years ago when I moved to Asia. The health journey part actually started officially in 2009, although I was presenting symptoms in 2001. So it took a long time to get my diagnosis. And originally what had happened was right after I got out of high school, I'd been experiencing a lot of dislocations with my knees and dislocations with my shoulders, that sort of thing. Wake up and wouldn't be able to lift my arm, that sort of thing. And I knew that there was something wrong. And I played a lot of sports in high school and university. And every time I got checked out by the doctors, they were like, oh, you're just working out too hard, or, slow down in the gym or slow down in the weight room. And they kind of pushed it off. And in 2009, that came to a head. My knees swelled up one day and they were about the size of bowling balls. Like, this is wrong. Was this from running yesterday, or I had no idea what was going on. And it got to the point where it was so bad I couldn't put any weight on my legs. So we went to ER. And that is where they found out that I had Ankylosing Spondylitis, which is now known as axial spondyloarthritis. So to tell you very briefly what AS is, it's basically inflammation of your spinal cord. And it's a type of arthritis that causes bone to grow. So it's also known as bamboo spine disease. And basically, untreated, it causes your spine to fuse together. So it's similar. I don't want to say it is a little bit similar to rheumatoid arthritis in that we take the same kind of medications. But because it hits my spine, it's systemic. It hits every part of my body. And so we started treating that. And then, I think it was 3 or 4 years later, the fibro hit. And I got my fibro diagnosis in November 2014. And that was a whole different level of pain and exhaustion. We knew that there was something going on. We just didn't know what it was. And I happened to be the doctor that I was working with at the time was familiar with it. I found out since that many doctors here in Taiwan just don't really know what fibro is. They don't know how to diagnose it or anything like that. So I was lucky enough to get a diagnosis from him, and then he retired. And after that, everything just kind of snowballed. I've been through about close to a dozen doctors since, trying to find somebody that can help.
Well, I mean, I know with sharing that and living abroad and all that. So were you living abroad at the original diagnosis, or where were you at?
I was living abroad. So I was presenting symptoms. I want to say it was midway through high school with AS. So AS went undiagnosed for a really long time. I had symptoms when I moved to China in 2003, but they weren't really, really bad. And at that time, I was 27. By the time I was 34, which is the average age for people to get their diagnosis with AS, that's when things really started to go screwy. And AS and fibro kind of go together. So I had symptoms in Canada and China and Taiwan, but it was the doctors here in Taiwan that took me seriously. And I had my diagnosis within a week.
I'm so glad they took you seriously for all that you've gone through, and especially starting out early age, it's easy to get dismissed, like you're just too young for all of this, like what's happening. So I'm glad you found that support. And it's, I mean, again, it's just you're have an incredible journey and so much to share with us. And it's interesting with the overlap of conditions as well.
Yeah, it's especially just having all of it kind of snowball together, and then having to navigate a system in Chinese, and then dealing with the cultural differences, like bedside manner and doctors' personalities here are very different to what you deal with in Western countries. So that's also been a real challenge, and something that I struggle with at every appointment.
And that's the things that you write about too, which is encouraging. And then with networking with you and learning, I mean, you really can help other people living in those countries with chronic illnesses. And I know that's part of your advocacy work that you help with, right?
Yeah, I've met a lot of people here with AS and with fibro that there's basically no support groups here, at least none that I've been able to access properly. So I have found a couple of groups that are in Chinese, but again, those cultural differences there are really, really tough to get across. So the people that I've met are usually expats here that have come over here and they've gotten sick here. Most expats come over here in their 20s, right? And then they end up, maybe they're here for a while, or maybe something has happened and then they fall ill. And a lot of them stay because Taiwan's healthcare system is actually excellent. It's a world-class healthcare system. 96% of the population here has coverage and access to healthcare.
Wow.
You can get in to see a specialist within a week, or get an MRI or your x-rays within a week. So we stay for the healthcare. But then there are these other little things that happen that kind of make things difficult. So I try to bridge that gap with people. If they find me through my blog or find me through my social media platforms, usually they reach out, and most of the connecting that I do is either through messaging, or if I can do a phone call, I'll do a phone call with them and kind of give them a little bit of guidance about where to go and what they can do to kind of make their lives a little bit easier. And most of them have no idea where to start. I mean, I'm sure you know what it was like when you got your diagnosis. It hits you and you've got no idea of what you're going to do.
Yeah, and especially at a young age, because I got hit at 14. So, of course, fibromyalgia was supposed to be rare for anything, and I didn't fit any mold. So I understand what it's like living and starting out so early. And I even read, too, we have some similarities of just inner childhood. I always say I'm like just allergic to everything. So it was, you read that in your blog post about your story, and just having that immune response at a really early age and just carrying it through. So we get it. We know what it's like.
Yeah, it's tough too, because when you get a diagnosis abroad, you don't have your family, right? You don't have your immediate support group around you. So you're dealing with it alone. And then you're struggling to find people that can talk to you about it in English. Because as I mentioned, doctors here, their English is good, but the bedside manner and the way that they discuss things with patients are completely different. Like, they won't go over what to expect. They won't go over side effects from different medications or anything like that. Basically, they're like, I'm the doctor, you're the patient, you do what I tell you to do, and that's that. And I have so many questions. I'm sure they hate to see me coming.
Well, I'm going to have a lot of questions on collaborating with providers overseas with all the medical education we want to do for fibromyalgia. I did want to take a second to say hello. You have some very good supporters out here. We have Estella dropping in to say hello, Tiffany.
Hi, Estella.
And Crystal from the Fibromyalgia Pain Chronicles. So I know that all of the group from WEGO Health supporters and our community is here. So thank you everyone for tuning in. This is, this is actually a good response at this hour. So we might have to turn our times around here.
I'm thrilled. Estella and Tiffany and Crystal, thank you so much.
And we have definitely more viewers I'm seeing on the count. So please comment and connect as and enjoy our discussion. One of the things, you had mentioned that you've traveled and seen more than 35 countries. I I didn't know what to do with that. So I haven't traveled very much. I don't travel well, but I haven't traveled much out of the United States. I think we probably went over to Niagara Falls, if that counts in Canada. But that's about it. So as someone who's extremely homebody, it was exciting to meet you and know that you've done so much traveling. What were some of your favorite places?
Oh gosh, so this last night I was sitting up thinking how I'm going to answer this question, because obviously when you're traveling and you've traveled as many places as I have, it's really hard to narrow it down to just a few favorite places. So this is what kept me up last night, trying to answer this question.
There's a lot of travel. I mean, you were teaching in China, and then now in Taiwan, you have your own business, and so it's like a lot of in between. And your blog showcases a lot of the traveling, eating experience. I was jealous on the food. There's really good looking food right there.
Oh my gosh, the food here is amazing, and I will go over some of that with you today, tell you some of my favorites, some of the weirdest things I've eaten if you want to know that, and some of my favorites. So to tell you my favorite countries, gosh, okay, so Japan is amazing. It's very weird and just wonderful. So we did a 2-week road trip. We rented a car, and we basically drove all over Japan, all over Honshu, basically. And that was just an amazing trip. Can't speak highly enough about Japan, and I really want to go back, but my husband thinks it's too expensive. So he did actually manage to get tickets to the Olympics this summer, and then the pandemic hit.
Oh man, that would have been so much fun. My boyfriend loves Japan, and so does my brother. So I think they've all discussed living there before.
That's actually where I wanted to go when I started looking at teaching abroad back in 2001. That was my first destination, and I ended up going to China just because sometimes when you're interviewing with schools, you just get a really good feel for a school. And the school that I ended up going with, my boss was amazing, and I ended up staying there for 3 years. And China was great. China is great for its own reasons, and I've got plenty of weird stories from there as well, but it's not part of my top 3. So my second favorite country is Spain. I just if you want to go and eat somewhere and soak up the sun and just have an amazing time, Spain is gorgeous, especially if you go with your best friend. And the third one is Laos. Oh. I really, really, really enjoyed my time there, and I wasn't expecting it to be as different as it was. When people hear about Laos, if they even know where Laos is, it's a tiny little country. And you kind of think that you're not going to see a lot of stuff there, but the amount of stuff that they've got there is just incredible. And sometimes you travel to countries and your initial impression of the country is, oh, this is cool, but I'm not sure I like it. And that was my reaction with Cambodia. I loved Angkor Wat. I thought that was amazing. I'm a huge, huge history buff, and I love especially going to see temples and old ruins, that sort of thing. I could do that all day, every day, if I could still do it. But there were parts of Cambodia that I just hated while I was there. And then when I got back home, I was like, oh, I miss it. You don't know what you're going through until you've gone through it and you've had time to think about it afterwards. And that's kind of what I really love about traveling is the experiences that you have when you're doing it, and then the memories that you have afterwards.
Well, looking at your blog post, I was really intrigued. I mean, now the traveling has ceased over here, but I was like, oh, I'm kind of getting inspired as opposed to being terrified of traveling. So it was nice to see all the blog posts and learn about your tips and all of that. So for someone who just, like I said, I'm just terrified of traveling along. It takes me enough time to get to like East Coast. Do you have some travel tips, secrets that you want to share with us?
Oh gosh. Okay. So as a disabled traveler, I could say that getting flight assistance is of the utmost importance when you're doing any kind of flying. So I've been using flight assistance since 2011, and it's not that hard to get. You have to be willing to put up with a little bit of, how shall I say it? you have to put up with a little bit of nonsense. But overall, it's really helpful because it saves your energy so that you can spend your energy on things that you actually want to do during your trip. As in terms of traveling, I'm one of those people, I don't really like to plan that much. And I'm actually known as Carrie has a plan Kellenberger, but not when I'm traveling. So basically, my husband and I, when we go somewhere, maybe we'll take like a couple of different locations and he'll pick 3 and I'll pick 3. And then we don't really get a choice. If he picks something like horse racing, then I've got to do it. But I actually really love the horse racing. It's not something I ever would have picked out before. I did that in Singapore. So I don't like to plan. And that's unusual, especially if you read a lot of travel blogs. A lot of travel blogs will tell you to plan, but I kind of like the rolling along with things as they go. And I think my other biggest tip would just be to read as much as you can. Part of the beauty about traveling is you've got to remember that you're an ambassador for your country. So you want to be able to present yourself in a professional way while also being respectful of the different cultures that you're experiencing. And that's a big one. Just recognizing that every culture is different, and you have to keep in mind and know ahead of time what's acceptable and what's inappropriate.
That's great advice. And I think if I haven't connected you yet with my friend Misha, from Fibro Life, we have to connect you.
I'd love that.
She's been trying to get me to travel. I think she wanted me to go on an African safari. And I mean, it's been hard with the pandemic. I mean, it slowed a lot of the stuff down over here, but I know a lot of people in our fibromyalgia team love to travel and are eager to get back to it.
Yeah,
so I really appreciate this.
It's a lot of fun. I can't say I've done a lot of traveling in the last 3 years. I've been actually really sick. So 2017 was basically, from 2017 until 2019 was just a bum year. It was a bum couple of years. So I was able to make the trips home to Canada. And if my mom is watching, I hope she doesn't take any offense to this, but it was basically dragging myself across the world and being sick in Canada and then dragging myself back to Taiwan and recovering and being sick here. So I'm hoping, now that I've had this year to kind of heal a little bit and haven't had to do any traveling, that when I go home next year, it's going to be a little bit easier.
And do you give yourself some more recovery time, like a day before you really get out there, or do you just like jump and get out there quickly after traveling on a plane?
It's impossible. I've got to build in rest time. So I guess that's probably a great point that I should have mentioned when you asked. If you're somebody that is dealing with chronic illness, you have to build in those break days. So I'm resting up until my flight, and then I need a couple of days to recover from my flight, and then I can go out and do something maybe for a couple of hours, but I've only maybe got 2 or 3 hours each day before I need to come home and rest. So that's limiting. But building that time in there is really important, and having a partner too that understands that is also really important. And I'm lucky that my husband gets it, and he's also willing to be my pusher when I need him.
Oh, that's fantastic. Yeah, having that partner support and that communication has been really important. I know my boyfriend talks about freezing me like Han Solo in order to put me on a plane, but at least he's kind about it when we land places, so he knows that it's like, okay, I need to go rest.
That doesn't sound bad to me at all. I wouldn't mind that at all. If I could take out the 30 hours of traveling part to get home and just be home, I think that I'd be able to do a lot more with my folks.
30 hours. Are you able to sleep on planes?
Yes, with medication.
I'm always impressed, even with medications, that people can sleep on. It reminds me so much of being in a hospital that it's always thrown me off, because it's just like, I think I have too much vigilance on the fibromyalgia side. So
yeah, there's tricks and tips that you can use with planes, with airplanes. I mean, I hate flying. I really, really hate flying, and that's only because I'm sick. I think I'd probably enjoy it more if I wasn't. But anyways, if you're a short person like me, you could bring a knapsack or bring like a little air cushion pillow and put it underneath your feet so that my feet never touch the ground properly. So I'm always like extending my toes out, and that wreaks havoc on your back and it's just uncomfortable. So bring something to put underneath your feet. And I would absolutely say too, don't get into the movies. Like have your meal service and then whatever you need to get to sleep, and then keep the TV off. Just read until you get tired.
Oh, wow. I didn't even consider that because I use the movies as the complete distraction. So
they keep you up.
Great. Get me out of here.
Yeah, I'm not like that. My husband will watch the whole time, but stuff me full of food, and then maybe give me a little bit of something to drink, and then I might watch one movie with them, and then it's reading until I sleep.
Oh, wow. Well, I mean, once we all get to start traveling again, it'd be nice to slowly build up. Oh, Tiffany wants to know how tall you are.
I'm 5'6", but I think I'm shrinking.
You're taller than me, and you said you're.
I'm tall here in Taiwan. Like I'm a tall Western girl for Taiwan. But I guess, I don't know, my husband's 6'9", so I feel like a shrimp. And it's still hard. Those seats in the airplanes are tough. And it's just because of the way they're built. They're not built for comfort. I don't know. I've got short legs, Tiffany. Sorry.
Well, I'm
long torso, short legs.
Tiffany, so we're both 5'4". So when you said being short, I was like, okay, so you're taller than the both of us.
Oh gosh, you guys got to stand next to my husband, and then you know how I feel.
Well, I had a business partner who was like 6'2". So, I mean, just flying, I've known people, it's tough to fly. I mean, I would always try to jump to get those front seats if we were flying like Southwest, so you have the more leg room, but
yeah. The window seat's always the best, as long as you don't mind climbing over people. You always get a little bit more room with that.
Is that what you choose, or you put your husband there?
Always. My husband's a big man, so he can sit on the outside, and he needs the leg room because he's like a stork, right? Legs and arms everywhere. So I prefer the window seat, and hopefully, we always wish that there's a middle seat so we can kind of stretch out a little bit, especially if we're on a long flight. Some flights we really luck out, and then we get a whole middle row together or something. But I have a feeling maybe that's going to be the norm for the next little while. I don't know. It's hard to say.
I hope that they keep it, because then maybe I would try a middle seat. I do the aisle because I have to have straight access to the bathroom as quickly as possible. So these are chronic illness things that we always have to be like thinking about. So I don't want to be stuck or like jumping over.
Is the bathroom more important, or is the headrest more important? I
think it depends.
Everybody's different.
Maybe chronic illness symptom you're really conflicted with.
It's the last time I got on a flight was actually last summer. I was coming back from Canada, and we had traveled from North Bay to Carleton Place. So it's about a 4-hour journey from our cottage. And then from there, we picked up my baggage, and then we drove another 4 hours to Toronto. So that's a lot of driving. I don't know how driving affects you with fibro, but with me, it's miserable. It's just, by the time I'm done 4 hours in a car, I don't want to see anybody or do anything. So we did 4 hours North Bay to Carleton Place, 4 hours Carleton Place to Toronto. And then I had to get on a plane and fly to Taiwan. And that was a 30-hour journey. And by the time I got through security and immigration and everything and actually got on the plane, they thought I was having a heart attack. I'd actually had a very sudden onset of flare symptoms. But you know what you look like when you're flaring. And Crystal's been showing some photos recently that kind of show the difference between this is me normally and this is me when I'm sick. And they almost took me off the plane. I'm like, no, here's my doctor's note, and here's all my medications. It's not a heart attack. I'm I'm just having a really bad flare and you need to leave me alone and don't wake me up.
Oh my goodness. Well, all of these tips are helpful with traveling because we want to inspire people in the chronic illness community to know that they can still like enjoy life and enjoy traveling, even living with a chronic illness. So you've inspired all of us with what you said. So I know that Tiffany had put here, and I'm going to show it again, is you're a beacon of inspiration and hope, Carrie. So that's why it's tremendous having you here.
Aw, Tiffany, I love you. She's the best.
Did you connect both through the WEGO Health or through other means too?
We did. And actually, I am always constantly amazed by that platform. The people that I meet through that platform are just incredible, and they're so kind and so helpful and so friendly. Before we got on camera, I was telling you a little bit about Cheryl at A Chronic Voice, and she was one of the first chronic illness bloggers that I've met, and I've met a lot of people through her community of bloggers. But WEGO was totally different. Like, that was just next level for me. So be able to connect with people like Tiffany and Crystal and yourself and some of the other, Damien, I connected with Damien as well a little bit. It's just been amazing. This last 6 months has been great.
That's fantastic. Well, shout out to WEGO and WEGO Health for all their hard work and connecting us together. I know it was nice to be on a community call with everyone. It's different and just open to having more conversations with patient advocates like yourself.
Yeah, it's been great. Even meeting up with Melissa at IBD Warriors. She's in South Africa. So we were chatting back and forth. Have you received your t-shirt yet? The t-shirts were arriving internationally, and I don't know if she got hers or not. She was still waiting the last time I talked to her. So I told her to put on her old one, and that's what she did.
Well, I mean, this is veering off a little bit, but it just reminded me in some sense. Oh, did we drop out, or did I just
dropped out and you're back?
Oh, I dropped out. Okay. Okay. Well, I was just wondering if you had any thoughts on I got distracted now. If you had any thoughts maybe on better connections like internationally. I know time difference, it's difficult, but like how can we like really come together with across the board?
Well, I think Cheryl at A Chronic Voice is really onto something with her community monthly blogger meetups. And I have to extend her a huge kudos, and she's probably not even expecting me to mention her today. But she's created these monthly blogger meetups where she hands out writing prompts. And then everybody writes about the prompts, and you can either use it as a personal journal experience, or you can make it into evergreen content and turn it into something that maybe might be more useful for your blog. So the last time I checked with her, I think she had close to 20 bloggers that are all over the world participating in this link up. And the requirement, of course, is that you go through the people that have entered the link up and you leave comments on their blogs, and then you reshare across your social media platforms. So to my knowledge, she's the only person that's doing something like this. And the participation that she's got in it is great. So I think one way that we could do that without having to worry about the time zone differences is getting more people to participate with the blogging side of things. And if there's some way that we could work that into doing some live stuff as well, that'd be great. But I know for sure you'd have Mel and I up at 1 a.m. or 2 a.m. if we were doing that.
I think I'm getting ready for it. So it's fun at least to connect this way, because again, my challenge is with traveling. So I don't know when that would happen. I'd have to send some surrogates like Estella and Juana over. I'm sure they wouldn't mind traveling to Taiwan and meet you in person.
I would love to have you all here to Taiwan. Oh, we would have so much fun.
Again, you'd have to freeze me in a container or something at this point. I would definitely need some coaxing, but I just love that Cheryl's doing that. We'll mention her tomorrow in the Community Connect because she does have a huge holiday giveaway that I spotted.
Yes. Yeah, she's got a really big one. I think this is her second year doing it, but this year she's got 34 or 35 sponsors, and unfortunately I did not get my time together well enough for her to be able to donate, but I did enter.
Oh, that's fantastic. Well, we hope to get her more entries tomorrow because we're doing a little screen share on our Community Connect and we'll link over. So we'll definitely have to link to that. Oh, here, Estella is saying, I'll sit next to you, Melissa. Let's go. I don't know if that'll help me. That won't be good for you, Estella. I need something to calm my anxiety, but not trigger, anything with my stomach. So it's a fine balance.
Yeah, it is. It definitely is. That's life with fibro, right? It's a fine balance.
Oh, I know. And just with more of the advocacy work that you're doing, are you working with other advocacy groups with AS and like MECFS?
Yes. So actually, I got started with Walk as One in 2014. Sorry, so back in 2014, it was called Walk Your AS Off. So that was that was a global team of walkers that we had set up with teams all over the world. And basically we got our teams together and we had a team captain, and you had to count your daily steps every day. And then the goal was to meet 1 million steps in April and May. So it started at the beginning of April, and then we do a big hurrah thing for World AS Day, which is the first Saturday in May. And then all of the steps would be compiled at the end of May. And then we'd figure out which team had worked the hardest or had walked the farthest. So the original idea there was to walk to the moon. And we took enough steps to walk to the moon. So now we've decided to walk to Mars, and that's going to take another 10 years. But we're getting there. So my team's called the Walking Spondies. We haven't done anything in the last 2 years. I've just been way too sick. I'm not even doing 3,000 steps a day right now. But our team we had about 64 members on our team that were out walking, and they were from all over the world. And then in total, I want to say there were about 60 teams that were participating in this. So on top of that, Walk Your AS Off morphed into our nonprofit, which is called Walk as One. And that's an official 513c5 nonprofit out of Maine. Oh, and okay. Yeah, it's we do a really nice work with that. I'm not involved with that board anymore. Ricky White has taken over now, and he's doing a fabulous job with it. But that also introduced me to the Spondylitis Association of America. So they were one of the first organizations that I reached out to when I got my AS diagnosis, and they are amazing. And the people there are just so nice. For me to be in Taiwan and dealing with a healthcare system in Chinese and not really having this mysterious disease that I'd never heard about before, you need support right away. And they were able to send me a lot of information, and then I print it off and take it into my doctor, and that works really well. I also got involved, I've been involved with the Canadian Spondylitis Association for 6 or 7 years now. WEGO, obviously. Try to think of what else. I'm drawing a blank now, Melissa. I know there's another one. Sorry, Open Medicine Foundation.
Oh, I love Open Medicine Foundation.
I love them too. They are so great. And I've been following Whitney's story since he got sick. So I not officially with them, but I'm following their work and trying to share it as much as possible. They're really doing a lot of amazing research right now.
Yeah, they've done us a great job. I mean, they really inspired me with like Support Fibro going to their research events, because they would hold them at Stanford. And so I was able to attend in person for the last few years and just got really inspired by like meeting the researchers, hearing from the researchers. I thought it was just a wonderful presentation. So I really like the work that they're all doing over there, and just the collaboration model that they've put together is perfect.
Did you meet Ron Davis?
Yeah, I was presenting and stuff like that. So I would just say thank you for all your work. I mean, I'm really shy, so.
Oh man, that would be amazing. He's Superman. I follow Whitney all the time. So every time he mentions Superman, I just think, what a special story that is to see a father and son like that. And his mom, Janet, as well. It just, they overwhelm me every time I see them post.
Well, and I just loved it, just how much they're so dedicated to figuring this out and all the research and then all the just support they get too. So it's a great organization. I think we want something like that for fibromyalgia for sure.
We do. And why isn't there, I keep wondering, like, why is there not more, like, it seems like it's not, I mean, it's taken seriously. I know there are loads of fibromyalgia advocates, but I haven't seen the associations like I'm seeing for like rheumatoid arthritis or ankylosing spondylitis or ME/CFS. Am I missing something, or?
Well, I know
Well, aside from your amazing site.
I mean, we started Support Fibro in 2017 to fill in the gaps. So we're finding that there are a lot of gaps. So I mean, we're coming out strong, and we're working with people like Crystal and Millie and other groups to try to just continue and push. I think over here we're in a weird zone now that we're hearing. If you go to like university hospital rheumatology departments and you're diagnosed with fibromyalgia, they won't treat you.
Yeah.
They'll give you the diagnosis, but they won't treat you citing research. So there's a lot of things where I feel like we moved forward over here, but it feels like we've gone backwards. And I'm impatient living with this for such a long time. I really want to get changes. And I think that's why sharing and like learning from you about your experience overseas and traveling abroad in the healthcare systems can really help. I mean, are there things that you think we could bring over to the US? I mean, I like that more people have healthcare coverage.
I don't know, like what you've actually just said to me is reassuring, because I've noticed the gap and I thought it was just Taiwan. To me, when I'm looking at stuff in North America, it seems like there's so much happening all the time, but maybe it's happening through the advocates and not through associations. The only person that I really know that's kind of doing an association type of work is Court Johnson. And I've been following him for a very, very long time. There's no associations over here. I would also say too that fibromyalgia seems to be a catch-all diagnosis here in Taiwan. They give it to you. If a doctor figures it out, they'll give it to you, but then they throw Lyrica and Cymbalta at you, and then that's that. That's the only thing they can do. They don't give you any lifestyle management tips. They don't give you any education on it. And I'm wondering, maybe they don't know about it. Like, am I the expert on this? And then I'm like, oh, I am the expert on this. I'm teaching them. They're just not learning yet. So I don't know if we could bring anything over unless we brought our healthcare system over. One benefit that I've got here in Taiwan is I can see specialists within 2 days if I need to.
Oh, wow.
That's fast. And it's very, aside from my AS medications, the system is very cheap. So the way our healthcare works is it's universal. The government picks up part of it. Your employer covers 30%, and then you cover 30%, your employer covers 60%, and then I think the government picks up 10%. So if you're a healthy person and you just have something going on that you need attended to, you can go to a hospital or a clinic here, you pay $5, you get your treatment, and then you walk out with your prescription, and that's it. And that's how dental care works as well. With specialists, every time I go to see my specialist, my rheumatologist, to actually see him and get my medications and do my tests and everything, it's $20 every time. The government and the company picks up the rest. So everybody has access to that. I think that Canada and America could definitely benefit from a system like that. But then there are things that we could take from Canada and America that we could bring over here that would help, like bedside manner and how doctors are working with their patients instead of telling patients what to do.
I mean, it's getting better. It's expensive over here, and it's still not there. You still get the same instances of doctors not believing that fibromyalgia is real, It is sometimes medication driven, and if that doesn't work, well, you're out of luck. So it's just an overall improvement I think that needs to happen with the chronic illness community, and just faster diagnosis, differentiation between diagnosis, testing tools. I think that's why I love collaborating with Looms for Lupus and learning more about lupus and seeing what they're doing and the steps they're taking. So
yeah, it's very, very inspiring to see what's happening with advocates. I'd like to see more happening with education and awareness with doctors.
I know that we're going to have a conversation about ECHO. We've been talking about Project ECHO for medical education. It's all virtual, and it's different. It's case-based learning, and so we're getting at personalized medicine rather than straight didactic, because I know sometimes you can insert bias. So I'm curious. I would definitely have separate. I'm curious if doctors in Taiwan will be interested. I know it's done really well in India. They have a huge track there, especially now with COVID. I need to take a look on the other countries to see how they're doing.
I don't know what I should say about bias here, because I'm still not quite clear on it. We've got those language barriers that are here. I'm assuming that when I walk into appointments, they're looking at me as a foreigner, and their education is based on Asian populations. So how Asian people present with certain illnesses is completely different to how I might present with illnesses. So there might be that bias there, but there's not a lot of talking going on about it. These aren't things that we really talk about over here. So it's really hard for me to answer that question.
I mean, we definitely love working as patient advocates together. So I think we're going to be the driving force as patients. So can figure all of that together. It would definitely be a great experience.
Yes, they're not going to see me coming in 2021. I'm going to be pushing hard because this petition process I'm going through right now is ridiculous.
Oh my goodness. Well, what's in store for 2021 for you and your advocacy work?
Well, obviously, I would really love to get more involved with advocates all over the world. So I really, really like your idea of being able to try and figure out something where we can get people from everywhere that are coming together and just talking more about the differences, and then trying to maybe see how we can get everything to mesh together. For myself, once I get access to the meds that I need, I'm really going to be pushing hard here in Taiwan and trying to get more awareness going, especially for fibromyalgia. There are way too many people here that are suffering from it and don't have any help or any support. I'd like to get more of a support type of group going on here, but I've been too sick to do that kind of thing in person. And honestly, even though we don't have there's no pandemic here. Like you would never know there's a pandemic happening outside in the world. We're in our own little island bubble here. Life is just swimming along. Everybody's wearing their masks. But I've still got that fear, right? Like I'm not really comfortable going out and seeing large groups of people. But I'm hoping in 2021, maybe we can get a bit more of people meeting up, patient meetups happening in Taiwan. Obviously, I want to do a lot more work online, especially with some of the advocates that are here in Asia. And I don't know, whatever rolls my way. I told you earlier that I'm Carrie has a plan Kellenberger, but if it comes my way, I'm just going to roll with it.
Oh, that's fantastic. Yeah. And I mean, I definitely connect you with Estella and Juana as far as they've had successful support groups. And I also noticed on your blog, you talk a lot about art and art therapy. So if there's anyone you have to like talk to, it would be Estella and Juana right now. So
I watched one of the painting videos last night.
Oh, fantastic.
Yeah. So I'm terrible with paint. But if you give me markers or jelly roly pens or flowers, I could do any of that. And I also do a lot of beading work. Yeah,
I saw you have a whole collection of art, but then you also were doing indoor gardening. So
yeah, I love indoor gardening. It's been great when you're housebound and you've only got your plants and your cats to talk to. It gets big.
Oh, wow. We definitely, again, have to have just a conversation on indoor gardening. I mean, I garden or try to attempt to veggie garden. So it's been a hobby in that sense. I finally gave myself a hobby.
Hobbies are great, and especially when they're hobbies that make you feel good, right? Like if it's art or gardening or something that's really zen and helps take your mind off of what your body is putting you through, I'm all for it. That's one of the first things that I suggest with anybody that's coming at me with a new diagnosis. Find something you love doing and that you can relax with.
Well, that's so fantastic. And then your blog post on art therapy and your interviews about art and exploring that was just tremendous. So I want everyone to definitely check out your website. I put it here for myseveralworlds.com. Before we close out the interview, I guess, do you have any last takeaways for our support fibro community?
I would love to reach out to anybody that's interested in chatting, whether it's an interview like this, as long as you're willing to work with the time zones, or if you want to do a written interview or anything, I'm open. I love meeting people. I'm a traveler. It's in my veins. I love meeting people and connecting with people and learning more about what people are doing. So if you want to reach out, I would love to hear from you. And I just look forward to seeing what everybody else is producing. One of the things that I've really noticed this year is how different everybody's advocacy work is. Crystal's a great example of somebody that's doing something very different to what I'm doing, but I'm just so inspired by the work that she's doing, that you're doing. So I want to see different things coming from everybody and hoping that we could somehow bring that all together.
Well, and I just encourage everyone to check out your blog. I mean, there's so much great content there. I spent hours just lost in your book reviews and your travel experiences. It's just a lot of great content that's all in your blog post. And you're on social media. We can also find you at different social media accounts, correct?
Yep, you can find me under My Several Worlds or Carrie Kellenberger. The only one that's different is Twitter. I'm under Globetrotter I.
Okay, I noticed that. You're like me. We have separate.
That was way before. Like I joined Twitter in 2007, so that was still when I was globetrotting and jet setting.
Oh, we all understand. And I just saw Crystal. Crystal is still awake. So hi,
Yay!
Crystal. Glad you're still up. Glad you enjoyed this. She has a long post here, so we'll have to get to this. I will have to read through this and get back to Crystal's response too in like Facebook posts. But I just want to say thank you so much. It's been tremendous connecting with you, Carrie. I appreciate the time, and I'm really excited, and I encourage everyone to check out your blog and your website. So thanks again, and please stay safe with the earthquakes.
I'm so glad we didn't do any rocking and rolling during our interview. Thank you so much for having me and for taking the time tonight. I really appreciate it. I'm not a night person, so for you to do an evening interview is that really meant a lot to me. And you're such a great person to talk to.
Oh, good. Well, you're welcome back. Like I think she should write a book. So we could talk all day long about all kinds of different things. So thank you to our support fibro friends for tuning in. Join us tomorrow morning at 9:30 a.m. I'll be with Looms for Lupus for our Community Connect. We have a holiday themed Community Connect. But thank you, everyone, and I'll see you tomorrow.
Great. Thanks so much, Mel. Bye, everyone.